Good morning and welcome. This is our second webinar within the Return to Work series. This is preparing your workplace safety. And we've got Deb Bridges and Lacey Partapillo on today's webinar. We are very lucky to have them both. Deb Bridges is with Safety Northwest and Lacey is a HR director at Xenium HR. Today's webinar, we're going to have an hour-long webinar. About 35-40 minutes will be presentation, 20 minutes of Q&As, and we have lots of questions that a lot of you submitted through the registration process, so thank you for that. And I also want to encourage you to submit questions through the Q&A module within Zoom. I'll be monitoring throughout the presentation, so feel free to ask as many questions as you'd like. I'll be monitoring those, and then we'll save time at the very end for those questions. So question we always get, recording, will it be available? Absolutely. The slides will also be available at the conclusion of this. Look for it in an email probably 2 to 3 hours after the webinar finishes. And then we have several other webinars in this Return to Work series coming up. So go to xeniumhr.com/events/webinars, and you can sign up for those last two. And we also have podcast and other videos and other great resources that you can sign up for. Okay, so we've got lots of great content. Deb is going to kick it off with a presentation. She's got lots of great material, and she's the expert in safety and the great reopening. So Deb, I'll turn it over to you. Thanks for coming on.
All right, thanks, Brandon. Sorry, I think I advanced the slides a little too soon there, but
that's okay.
Continue to do that.
There's some links for you. We'll also repeat the links for people later, but there's lots of great stuff.
There's the housekeeping information that that Brandon went over. And thank you, Brandon, and thank you, Lacey, for being here. And also thank you to everyone who is participating. I'm looking forward to sharing some information with you. So we'll just get started. So I'm going to talk a little bit today about, as we're looking at the reopening process, as we're going into phase one. Obviously, some counties around here have already entered phase one, both Clackamas and Washington County, and of course the rest of the state is already in phase one. But as we're looking at phase one, what do we need to do as employers? And looking at it from a safety perspective and also a little bit from an OSHA perspective, like, what is it that we need to do to make sure that our employees are feeling safe and staying safe at work? So again, remember that as an employer, you are responsible for maintaining a safe work environment for your employees. And really what that means is, looking at OSHA's general duty clause, that general duty clause requires employers to provide their employees with a workplace free from recognized hazards likely to cause death or serious harm. In addition, Michael Wood, who's the director of Oregon OSHA, when we first went into when the stay-at-home orders first went out, and OSHA released their first guidance menu, basically what he said was employers need to understand that even in unusual times like this, employees are still exposed to hazards, and it is still the employer's responsibility to ensure that their employees are adequately protected from those hazards. So the key thing here, as an employer, really OSHA looks at COVID as another hazard. So what do we do in our workplace to protect employees from this new hazard? So in many ways, again, it's going to be similar to other hazards. So what do we need to do? We need to make a policy. OSHA kind of calls this an infectious disease preparedness and response plan. And depending on the size of your organization, this may be a very large document or it may be a smaller document. But the important thing is that we've done our due diligence. So we need to think about the levels of risk that are associated with our work environment. Again, how do we protect our employees? So what we want to do is we want to assess our exposure risk. Are we low, medium, high, or very high? And I'll go into the specifics of those in just a minute. And when we're thinking about that exposure risk, we're thinking about how, when, and where might employees be exposed to COVID-19. So we're going to think about the general public. We're going to think about coworkers, customers. Do they have contact with sick individuals? what are some of their non-occupational risks, what are some of their individual risks, and then we're going to establish workplace controls necessary to address those risks, same as we would do for any other hazard. And again, we're going to look at those in more detail, but they're typically the engineering, administrative, and personal protective equipment. So in addition to developing a plan, we need to appoint an individual or a team of individuals who are in charge of implementing and overseeing this plan. OSHA likes to call these folks the social distancing officers. So they're very important. We also need to implement measures to protect our employees and to protect potentially our customers. So it's the basic infection prevention measures. So it's the sanitizing, the hand washing, all of those things that we all have become very, very, very familiar with. So we want to promote frequent and thorough hand washing. We need to, we may need to provide additional hand wash stations. If we cannot provide additional hand wash stations, then we need to provide hand sanitizer stations. We need to practice physical distancing. I like to use the word physical distancing rather than social distancing because we're still social people. We still need to be social, but we just need to do it farther apart. We should not be allowing workers to share desks, to share phones, offices, and that's again in close proximity, work tools or equipment. We need to encourage workers to stay home if they're sick. This isn't the time to sort of champ it out and, hey, I never take a sick day. I'm always going to work. So if you're not feeling well, don't come to work. You want to encourage good respiratory etiquette. So making sure that people are covering their cough, covering their sneeze. We might have some new practices. Obviously, we've all become very, very familiar with working from home. Well, that's a good way to prevent infection, right? You also might want to think about staggering when people start, staggering their lunches, staggering their breaks. Again, we want to minimize the congregation of people. And then, of course, we're going to increase sanitation, especially any high-touch areas. Okay, so I talked a little bit about establishing controls. So whenever we're dealing with a workplace hazard, what we need to do and what OSHA is looking for all employers to do is to use this hierarchy of controls. And if you think about it, imagine that you're at the bottom of this pyramid. And the most effective thing is obviously going to be at the top of the pyramid, and the least effective is going to be at the bottom of the pyramid. So we want to try to go through most effective down to least effective. That's a great way to think of it. And also we want to try to put as many of those controls between the worker and the hazard as possible. So you think of the hazard being at the top and the worker being at the bottom. So the most effective way and the most is to eliminate a hazard is the most effective thing to do is to eliminate the hazard. So again, this might be where we're having people work from home. Next thing we want to do is substitute. Is there any way that we can maybe have them work less or we can have them do something else? Substitution is very often used when we're dealing with things like hazardous chemicals. So, we're going to substitute a less hazardous chemical for a more hazardous chemical. Oftentimes what we're seeing with COVID is if we're asking workers to come to work, then we kind of are starting at the engineering controls rather than at elimination and substitution. So engineering controls are where we're reducing exposure. So it's things like, are there things that we can do to kind of minimize that exposure to the employee? So it's maybe installing high efficiency or HEPA air filters in the office. Maybe it's physical barriers, which we've seen, such as the clear plastic sneeze guards. Administrative controls are going to be one where we're changing the way that people are working. So this is where we're encouraging workers to stay home. We're doing more virtual meetings rather than in-person meetings. And then we're always keeping our workers up to date with education and training, including training on PPE. So personal protective equipment, or PPE, is it's the last resort, right? It's going to provide the least amount of protection. We can use PPE in conjunction with other controls, but we don't want to go directly to PPE and assume that that's going to be the only thing that we need to do. And of course, we all know what PPE looks like now. It's funny, I think 6 months ago, if I would use the term PPE, people would kind of be like, what? I'm not sure what you're talking about. Now everybody knows what PPE is. But anyway, we need to make sure that PPE fits correctly. We need to make sure that it's consistently and properly worn. We need to make sure that it's regularly inspected, maintained, and replaced. And also we need to understand that if PPE is required for an employee's job, the employer must provide it for them. Also, if PPE is required for the job, the employee must wear it. That's another thing. Think about construction, right? And on construction sites, high-vis vests, hard hats, those are all required PPE. If you don't want to wear the PPE, and this, Lacey, is probably something that kind of starts to fall into the HR realm. If you have employees who are refusing to wear their personal protective equipment, you've gone through the assessment and it's required for their job. I don't know if you want to say anything else about that, Lacey, but I mean,
yeah,
I had that question.
If the employer's requiring it, it's a requirement of the job, just like any other requirement. So showing up to work on time is a requirement of the job. So when an employee is refusing, I would encourage you, either the manager or someone in HR, to have a conversation with the employee about what's going on. There may be some physical reason that the employee can't wear the PPE. So I've had situations where the mask creates more issues for an employee. And so we have to look at alternatives and possible accommodations under the ADA for that employee or that individual. But it is a requirement and should be handled, any in a similar way as how you would handle any progressive discipline situation with an employee that's refusing to follow a policy or a protocol.
Excellent, thank you. Okay, so again, I touched on earlier about determining exposure risk. We need to determine our exposure risk in order to determine our appropriate workplace controls, right? So what we need to do is we need to figure out, are we low, are we medium, are we high, or are we very high exposure risk? Low exposure risks are typically jobs that do not require contact with people known to be or suspected of being infected with COVID-19, or you don't have a lot of close personal contact with the public. So typically you don't need any engineering controls. Administrative, you're just going to make sure workers have appropriate information. There typically isn't any additional PPE required other than what's already required for the job. And typically we're going to see those low exposure in warehousing and manufacturing and things like that, where there's not a lot of contact with the public. So medium exposure, I find a lot of times that the bulk of jobs are going to, the bulk of industries are going to fall into medium exposure. And these are going to be jobs that require frequent and or close contact with people who may or may not be infected with COVID-19. We don't know. So this is a lot of times the general public. So this is where we're going to see physical barriers. This is where we might see some signage about COVID-19. We might see limited amount of customers or workers in a particular area. We may be requiring employees to wear gloves, gowns, face shields, things like that. And again, in phase one, some sectors are required to wear masks or face coverings. So just make sure that you're paying attention to your phase one sector specific requirements. High or very high risk, these are going to be folks who are typically working in healthcare. So the healthcare industries are going to fall into that high and very high risk category. The high risk are folks employees who are working with people who are known or suspected sources. So, and very high are people who are going to be working with confirmed cases. Typically they're performing medical procedures. So again, some of those controls, we're going to see this where we're going to see isolation rooms. We're going to see very specific kind of air handling. Again, there might be some specific policies and some very specific PPE requirements. Okay, so when it comes to developing a policy, so have we done all of the things kind of that I just was reviewed? Did we determine the level of risk associated with the workplace? Did we analyze the tasks involved and identify potential hazards and exposures for our employees? And we may need to use a job hazard analysis to do this. But again, think about the fact that COVID is another hazard. So you've got to look at jobs and look at tasks differently and keep COVID in mind. What do I need to do to keep my employees safe? And then you're going to use all of those in those hierarchy of controls. Again, remembering that we want to put as many of those controls between the hazard and the employee as possible. We want to make sure that we've implemented basic infection prevention measures. We want to make sure we've appointed someone to be in charge of the policy, to make sure that they're enforcing the policy, also that they're kind of a liaison, you know, for employees. Who do employees go to if they have a concern? Our policy also, we want to make sure that we include the mandatory 6-foot physical distancing. I can't stress this enough. This is probably one of the most important things that you can do, is to maintain that 6-foot physical distancing. You want to make sure that you've got an option for telework. You want to make sure you've got something in there indicating that you are encouraging employees to stay home if they feel sick. Lacey, I don't know if this is another kind of HR point to where, you know, employers can make their employees stay home.
Yeah, I think a lot of employers are asking employees to self-monitor their symptoms. So some are even asking employees to take their own temperatures at home before they come to work. So paying attention to the symptoms, and, you know, even providing employees with a list of the symptoms that the CDC has put out. So if I'm an employee and I'm required to come into the office, I'm going to, in the morning when I wake up, I might take my temperature, I might look at the list and see, am I experiencing any of these? And then I would encourage folks to take a look at their attendance policies. So employers that have had what I would say rigid or strict attendance policies may consider being a little bit more lenient right now, and allowing employees a bit more flexibility to avoid having someone who may be, you know, have been exposed or may possibly be sick with COVID-19 into the workplace.
Thank you. Also in our policies, we're going to want to indicate who's in charge of enforcing the policy. We want to talk a little bit about our infection prevention measures. We also want to talk about our isolation practices. So this is definitely something that, particularly in phase 1, you want to make sure that you have a system in place to identify employees who get sick on the job, and then to isolate them. And basically, what are you going to do if somebody becomes sick at work? How are you going to take care of that individual? So you got to think about isolation practices and then next steps for that employee. So that's important to have in your policy as well. And then, of course, one of the most important things is anytime we have a policy, we need to train and educate our employees on that policy. And if possible, as you're developing this policy, encourage your employees to be a part of it. Obviously, there's a lot more buy-in when employees have the opportunity to be a part of creating a new policy. So ask for their feedback. Ask them about tasks. Ask them, hey, are there any tasks that require you to be closer than 6 feet? Is there any way that we can alter these tasks? Is there any way that we can do them differently? Can make some kind of administrative change. So really encourage your employees to participate. And also you want to really encourage that communication. If employees are frustrated about the policy or they don't understand part of the policy, you need to make sure that they have an avenue to express those concerns and express those complaints. Because I will tell you, and I'm going to talk a little bit more about it as we get farther, OSHA has received a number of complaints since the stay-at-home orders went into effect. And most of those complaints are from employees concerned about their safety at work. So really what you want to do is you want to tell your employees, look, we've assessed the risk. We've taken all of this time. We've done all of these things. So we've assessed all this risk. These are all of the things that we're doing to keep you safe at work. So that's a really important concept that you want to get to your employees. Hey, we're listening, we care, we're paying attention, look at everything that we're doing. Is there anything else we should be doing? And solicit that feedback. It's also really important to maintain your current safety program, right? It's not just about COVID, but keep maintaining the rest of your safety program. And again, I kind of just talked about this, but you want to make sure that employees have a reliable method for reporting hazards, including COVID-19. But it's not just COVID. Make sure that they have the ability to report any other concerns that they might have. Make sure that if you have a safety committee, that your safety committee, if it can't meet, which maybe it can't meet right now, but make sure, again, that the safety committee members are kept informed of any hazards that come up, and that employees are kept informed about hazards that come up, and then any findings or any corrections that you've done need to be communicated back to employees. Or if you're having trouble, like maybe you've ordered a lot of PPE, but it's not coming in, tell your employees that, right? Again, it's just about communication. We want to make sure that they feel safe at work. Making sure that employees' concerns are addressed. You want to make sure that they all have proper PPE. And of course, with everything that's going on, employees may not be as focused on general safety at work as they would normally be, right? Because there's a lot going on. Okay. So as we're rolling into phase one, what else do we need to know? So I will tell you, the Oregon Health Authority is responsible for creating guidelines for the state of Oregon. Now, these guidelines are going to vary from state to state. So if you have businesses that are in Washington state, you need to be paying attention to what Washington's doing, because Washington is different than Oregon. In fact, I can give you an example. In Washington, all construction sites require face masks or coverings 100% of the time, whereas here in Oregon, it's only task specific. So that's one very important difference. Also in the state of Washington, gloves 100% of the time on construction workers, not in the state of Oregon. So again, make sure that you're paying attention to not only your sector requirements, but also state requirements, because those are going to be different. Oregon OSHA is responsible for the enforcement of the guidelines that are created by the Oregon Health Authority. OSHA is not creating new regulations right now. When OSHA creates regulations, it's a very, very slow process. And they typically are going to create regulations oftentimes when there's legislation, for sure. And of course, there hasn't been any legislation with COVID. So I would go to the Oregon Health Authority and then know that OSHA is just going to be following up on whatever guidelines the Oregon Health Authority is putting out. So what else do you need to do besides what I kind of just talked about? Obviously, you need to comply with any of the governor's executive orders that are in place. And all of those executive orders are also on Oregon Health Authority's website. So if you're wondering where to go, they're on their website, on their COVID page. You need to know the signs and symptoms of COVID-19 and what to do if an employee begins to show symptoms at the workplace. You need to understand how COVID is transmitted from one person to another. And we know that this, that's soft because we're getting new information all the time. But what we do know is that 6-foot physical distancing is still the most effective way to prevent the transmission, as well as good hand washing and frequent hand washing. There's no substitute for good frequent hand washing. And, some other respiratory etiquette things, but really physical distancing, and then hand washing, and then obviously face coverings when we need them. So we need to make health and safety a priority by implementing safeguards to protect employees and to protect the public. And again, pay attention to any sector-specific guidance. You may need, I talked about this already, but you may need to modify employee schedules, breaks, et cetera, to reduce unnecessary. We want to reduce that congregation. And that becomes really important. So you don't want to schedule everyone at 7 a.m. So you got the big, crowd around the time clock. You want to think about breaks. You want to think about break rooms. You want to think about high touch and common touch areas. I got a lot of questions about, wow, I have a kitchen that a lot of people are using. Should I continue to let them use it? I think, I know a lot of businesses, what they did is they removed a lot of those high touch items, water coolers, coffee makers, all of those things. Other businesses have just instituted policies and procedures to get those areas sanitized more often. So I think you kind of have to pay attention to your work environment. But if you get rid of them, then you have less chance of you're doing more to prevent transmission. I don't know, Lacey, if you have anything to add right there, but.
Yeah, I've had some clients that have gotten employees involved in the sanitation too, so have provided them with training about how to do the proper sanitation. And then there's a rotation where all employees are participating in that. So again, to your point, Deb, the buy-in from employees is really important right now. They want to feel like they have a voice in this. And I think the more we can do to encourage that, including participation in creating and maintaining a safe work environment, I think that's going to be really important as folks have their employees start returning to work more frequently now.
Perfect. Thank you. Okay. So again, how do we keep our workplace safe? So we're going to implement physical distance measures. Obviously I can't talk about that enough, right? We want to make sure that we're maintaining that physical space between workers at all times. And that might be doing a lot of the things that we've seen, right? Maybe it's floor markings, maybe it's plexiglass shields, maybe it's tables, other barricades, things that we need to do. one thing that we have to be careful about is whenever we install barricades, we might be minimizing airflow in an environment, and airflow is important, particularly in closed spaces. So that might be something to think about. If you might want to think about the height of your barriers or the number of barriers in a room, because what we don't want to create is we don't want to create pockets where theoretically we've got some stuff that could hang out in the air. I know that that for slot machines, for video lottery, the OHA is not allowing partitions to go between those slot machines because they're afraid that will create pockets of air. So, that is very specific, but also, that makes me think, oh, we need to be careful about a lot of partitions in small office spaces. We want to restrict the use of shared equipment and sanitize between uses. That's really, really important. That we're sanitizing equipment between uses. I see this a lot on construction sites, and they've been really creative about how they're sanitizing their tools, but also think about that at work. If you have shared workstations, is there any way that you can put a plastic cover over a keyboard so that you can sanitize that plastic cover between people? Again, try not to have them share desks, try not to have them share phones, keep that to a minimum as much as possible. Again, good hand washing, we can't talk about that enough. The same with the disinfection and sanitizing schedule for any high touch or high traffic areas, limiting the number of employees gathering, and then restricting non-essential meetings or conduct them virtually. Also, one other thing that the Oregon Health Authority is basically saying you might consider, these are not required, and from what I understand, they're not required for any sector right now, but the regular health checks kind of that Lacey was talking about, I have seen some employers that have definitely instituted this. It is not required, but it is something that you could do. You could ask your employees to do, they can self-screen or they can do it before they arrive at work. Another thing is you may want to consider any sort of facility upgrades, such as no-touch faucets, hand dryers. You may want to increase fresh air ventilation or think about filtration, think about touchless payment methods. And again, we're going to train all of our employees in safety requirements and expectations, and always, always, always document the training, because if you don't document it, it didn't happen. Okay, I wanted to take a couple minutes and talk a little bit about what the OHA is saying about masks, because they're out there, everyone's wearing them. So what does the OHA say? Because as you look at sector-specific guidance, they will use specific language. So when they talk about masks, a mask means a medical grade mask. A face covering is a cloth mask. So this would be, it could be cloth paper, or it could be one of the masks that were made, that we're kind of making at home. That's considered to be a face covering. A face shield is actually something that's worn on the head. It's plastic, wraps around the forehead and comes down and extends below the chin and wraps around the face. So businesses, they must require employees, contractors, and volunteers to wear a mask, face shield, or face covering. Again, it will depend upon your sector specific. Some industries are saying you have to wear a mask. Other industries are saying that a face covering is okay. But employees, contractors, and volunteers need to wear something, whether it's one of those three things. You have to provide them for your employees. You have to make sure that you are complying with ADA policies and procedures, as Lacey mentioned earlier. There are some people who cannot wear a mask. They might be an employee and they might be a customer. So you need to make sure that you have a policy that includes those folks. If you are requiring customers or visitors to wear face coverings, you need to have a policy around that as well. And your policy must provide exemptions to accommodate people with health conditions or children under 2 years old. You have to provide ADA exemptions and accessibility. You have to also take into account that requiring face coverings affects people differently, particularly communities of color. There's in wearing face masks, so you just need to be aware of that and think about that. You also need to consider providing face coverings for customers or visitors who do not have one. You also need to post signage, making sure that your customers know that they're required to wear a face mask before they come into your establishment. Do you have anything to add to that, Lacey?
No, I have heard a lot though from the clients that I'm working with, frustration from employees when the employer is not enforcing the policy consistently or enforcing it to the visitors and customers coming in. And so we talk about, this policy needs to be put in place, and it's really, really important that once that's done and communicated, that we're holding ourselves as an employer accountable to that, because there's really, in my mind, nothing worse than telling employees these are all the things we're going to do to protect you, and then employees come to work and we're inconsistent. So consistency is really, really important here, for health reasons and also just for employee morale, I think, right now.
Mm-hmm. And then obviously businesses, if you're going to be posting any sort of signage, make sure that people can understand it, post it in a language commonly spoken by customers. And then it's really important that you educate employees how to safely work and communicate with people who cannot wear face masks or face coverings. You may also have someone come into your establishment who is hearing impaired and they need to read lips. So they may ask your employee to remove their mask so that they can communicate. And it's important that you train your employee how to do that safely and how to then interact with that customer safely. And again, the big thing there would be 6-foot physical distancing. And I would also try to place a barrier between your employee and that customer as well. But that's really important.
Can I jump in real quick?
Yeah.
We're getting a lot of questions just about the face mask and clarification around which businesses need to require their employees to have face masks. Is it office workers? Is it ones who have customers coming into the building? What can you just define who's really required?
So again, this goes back to sector specific. So personal services, for example, so that's hair salons, tattoo parlors, places like that. Those employees are required to wear a mask. So that's a medical grade mask, okay?
So an organization that is closed to the public, meaning no visitors, they would not be required to wear face masks.
Depending on the proximity of employees to each other.
So if they're not, they don't have the ability to have distance by 6 feet or more, then they would probably be required.
Yeah.
Okay.
So I would say if you're a low risk business, you're not open to the public, and you're able to maintain 6-foot physical distance, your employees probably do not need to wear any face coverings. Okay. If you're a business that has minimal contact with the general public, maybe a plexiglass shield would be okay, and then you could wear a face mask if your employee wanted. But again, the hard part about it is in phase one. In phase one, I mean, that's when they're starting to say employees should be wearing face coverings. So it's it becomes a little. Unfortunately, there's not like, unless you're personal service. I mean, I can definitely say yes, all employees must be wearing masks. Other times, I think that's when it becomes really important to kind of establish your exposure risk, look at the tasks that the employees are doing, and then kind of go from there. I don't know if that's.
Yeah, I would agree. I think it's doing that job hazard analysis that Deb spoke about, and I think there are some businesses where there may be certain roles within the organization that their exposure is higher. For example, someone who's sitting at the front desk and maybe receiving things from the mail carrier or from UPS, versus someone who is sitting in the back of the office or out on the manufacturing floor working on a machine that they don't have, contact with other people. So the policy, the procedures that we put in place, it's not just company wide. It really needs to be focused, I think, on the roles and the individuals so that we can take a customized approach to the hazards that each person's exposed to.
Mm-hmm. Yeah. Should we keep going, Ryan? Did that kind of, okay.
Yeah, that's great. Thank you.
Okay. All right. So I'm going to try and get through the last few slides here so we can answer some more questions. Basically, I'm going to quickly talk about, so what happens if OSHA comes for a visit? So I will tell you that since the stay-at-home orders went into effect, OSHA has received close to 4,000 complaints in regards to COVID. And to give you perspective, normally OSHA receives about 2,000 complaints in a year and about 4,000 in a month. So this is, and they're coming from the public and they're coming from employees. Again, this is why it's really important to have that open communication with your employees, because you want employees to bring their concerns to you rather than picking up the phone and calling OSHA. Basically, what OSHA is doing about that is they're conducting spot checks. So the first thing that they're doing is they're making sure that employers are complying with requirements aimed at curbing the spread of the pandemic. So if businesses are supposed to be closed, they should be closed. OSHA doesn't have the ability to close them, but they are going to spot check. They're also going to make sure that employers are doing what they're supposed to be doing to protect employees from hazards. Kind of this whole thing that we've been talking about. Physical distancing, again, becomes really important. And have you applied appropriate workplace controls? Have you taken the time to do a job hazard analysis and make sure that you're keeping your employees safe? They are focusing more on recent complaints, those that have specific allegations. They're still conducting other investigations and inspections, but right now I will tell you that this is taking a lot of their time. In fact, they've taken a lot of their, the folks that typically do other work in OSHA, and they've brought them over to the enforcement side to help them kind of go through all of these spot checks. If you do have an OSHA inspector come, they will always show you ID. They will always indicate why they are there. It's just important to be prepared to answer the following questions. They're going to want to see that you have a policy. They're going to want to see that you've trained your employees on the policy. They want to know how you're addressing employee concerns and what controls you've implemented to minimize exposure. They might be looking for job hazard analysis. They're going to be looking at your employees. They may ask your employees questions to ask if they've been trained on the policy, if PPE is provided for them, if they've been trained how to use it correctly. So they could definitely interview employees. Please know that OSHA does not issue citations on the spot. It's not like getting pulled over by a police officer who's going to write you a ticket. Basically, they'll take their information, they'll go over their findings with you, and then they will leave, and then they'll send you a citation. I have heard that there were, especially in the beginning of the stay-at-home orders, there were fake OSHA inspectors going out and writing citations, and so that they don't do that. Also, because OSHA is pretty busy right now, they may send you, if they receive a complaint, they may send you an email it's called a notice of complaint rather than coming to visit you. You have 5 business days to respond to those. They're going to ask you to investigate the alleged hazard, provide proof of elimination or correction. So take pictures, talk about what you're doing, include your policy, include employee training. Sometimes I think it doesn't hurt to send them all kinds of information, even though they didn't ask for all of it. You want to provide your policy. You also want to let them know who your social distancing officer is, just kind of give them all kinds of information. Basically what you want to do is if OSHA contacts you or shows up, you want to be able to hand them a lot of information. You want to be able to say, look at all the things that we're doing. Here's our policy. Here's our person who's in charge of it. Here's all our documented training. Here's our PPE. Here's our training. Here's everything that we've done. What else do you want? That's what you want, because that's what they're looking for. Again, remember, COVID is just another hazard. OSHA wants to make sure that you are doing everything that you can do to protect your employees. If you do get a complaint, we're always here to assist in any way that we can. Okay. In summary, so what do we need to do? We need to create that infectious disease preparedness plan, otherwise a COVID-19 policy, I like to call it. We need to appoint somebody to oversee the policy, or a team of people to oversee the policy, depending on the size of your business. We need to implement disinfection and sanitizing procedures. We need to determine our workplace exposure risk, because that's how we're going to implement workplace controls, again, especially when it comes to the mask question. And be sure to go to OHA's website and look for anything sector specific on that. There it is. Follow sector specific phase 1 guidelines for reopening, including the guidance. Maintain your current safety program. Train your employees on policies and procedure. Provide an avenue for employees to talk about what's going on, talk about their concerns. I forgot to put in here, also make sure that you have a policy or a plan if someone gets sick at work. What is your isolation policy? What is your strategy if an employee begins to show symptoms at work? That is really important. And then just be prepared for a potential OSHA visit or an email. You would just want to have all your ducks in a row. Some resources. So one of the things that Safety Northwest is offering is we have a safe returns program. So basically we can help businesses with reopening. Basically we'll do kind of that COVID-19 policy for you. We'll help you out with your phase specific reopening guidelines. We can come and look at your workspace and see, you know, what we need to do for physical distancing. You know, just check with Xenium, check with your Xenium rep to see about costs on that. But typically it costs most of our clients $350. But we're definitely available to do that. Also, reach out to Xenium. And this is an example of one of the checklists that we provide. And then obviously additional resources. On the Oregon Health Authority page, when you go there, there's a ton of information. What you'll want to do is you'll want to click onto their COVID-19 link. That will take you to their COVID-19 page. You have to scroll for a while. When you find governor's orders and OHA guidance, you would then click on OHA guidance, signage, and rules. That is the section that will have sector-specific signage. There's also the link there for Oregon OSHA. Again, Oregon OSHA just enforces OHA's policy, so start with OHA. If you have any questions about your sector-specific, you can reach out to us. You can reach out to Xenium. And then, of course, Xenium's resource page is on there. All right, the last one.
Oh, question time.
Yeah.
Okay, so we got lots of great questions, and thanks to those that sent in a bunch of questions through the registration process. So some of these will be directed towards Lacey, probably from an HR perspective, and then Deb, anything probably technical, but feel free to jump in if you guys want. So there's one question that I thought was very interesting, especially as we get into the summertime. So this question comes from David, and he asks, would love to hear about guidelines around staff going on vacation outside of the area and how to mitigate risk of COVID-19 when they return. So go on vacation maybe out of the state, come back. Well, what sort of practices should you put in place in a situation like that?
The first thing that comes to mind is just the policy that Deb talked about. So this should be addressed in that policy. So we're proactively communicating to employees what to expect if they are going to be traveling. I think the big concern is around international travel. So employees that may be traveling internationally, and then what do I do when they come back? Can I require them to be tested? Can I require them to work from home? So I think the choice to self-quarantine, some employees are willing to do that on their own. And so having a conversation with your COVID-19 task force or that safety officer that Deb was talking about, what's our comfort level with having people come back to work? If you have telework available, I think that's always a great option. So we're just mitigating that risk, right? Lowering the chances that that person may have been exposed outside of the state or the country and bringing that back into the office. You are able to require testing. What I'll say about that, though, is that it's really important to be consistent. Testing is not accessible for everyone. So depending on where folks live, the employer requiring one of their employees to go be tested, the medical facility may not do it. I mean, I know of cases where there are people who are sick, who have symptoms, who were not provided a test or who were not tested. So I think that's something to think about. And anytime someone is well and able to work and the employer is saying you can't work, you can't come in, our best practice advice is always to compensate that employee if it's our choice not to allow them to be in the workplace. I don't know if you'd add anything to that, Deb.
Yeah, the only thing I would add is if you are doing pre-screenings, that could be a question that you ask. I've seen that question asked where basically it's something to the effect of, have you traveled to a hotspot area in the last 14 days? But again, it would be important that was part of your policy. So.
A few questions we're getting over and over again. people want slides, people want the recording, and we'll follow up with all that, including the links and the resources that were mentioned. I know we had to go kind of fast. There's a lot of information to cover, so we'll make sure to follow up with you guys. So if you miss something, you'll have it. Another question we're getting quite a bit, and I don't know if this is a Lacey question or a Deb question, but we talked about policies a lot throughout this presentation, and that we should have one. It's a good recommendation. Is there a template for free out there somewhere? Is it something we can buy? I don't know if that's a Deb question or not, but
I actually have one that was put together, that we put together for one of our clients. Lacey, I could send it to you. It's got a lot of the general information. It's a little specific to a particular industry, so maybe, but I'll definitely send you something, and that could be something that could at least be a template.
Great.
I'm sure there's other templates out there by now, but this is one that we have.
Great.
Yeah, that would be great.
Excellent. Let's talk about some behavior-based things. So this is probably a Lacey question. How do we enforce social distancing with employees that tend to invade personal space of others?
This was a problem even before COVID. So, I think, like Deb said, getting employees buy-in. I think there's enough out there in the media and social media. Everybody knows that it's important. I think the challenge that people have is in maybe lack of self-awareness. And so, over-communicating the expectations is important, putting that in the policy. I've seen employers have marks on the floor even. So spots where people can be standing. We see that in the grocery store, and the lines feel really long, but they move quickly because there's lots of space between people. So I think that's an option too. And, if we get to the point where people just aren't respecting it, so you've got the employee that continues to come into the bathroom, even though we said only one person in the bathroom at a time, we start having performance conversations with those folks, and providing them with information about what they're doing, why is it having an impact, what the policy is, what your expectations are. If things continue, you are putting your business at risk, in my opinion, of allowing that employee to continue to be in the workplace if they're choosing to engage in unsafe behavior. So most employers have a policy about, disciplining folks for engaging in unsafe work behavior. It feels a little strange to say standing close to someone is unsafe work behavior, but right now it is. And so having a plan for how are we going to discipline folks that are doing that, if that's the route you're going to take. I hope that just some coaching and some education is enough. Maybe taking some of this information that we're providing today and maybe creating a modified version of it for your staff, even educating employees about why it's important. When people know, I think they do better generally. That would be the approach I would take.
Yeah.
Deb, was most of this information in the presentation related to phase one? A lot of people are asking if it is, and if there's any sort of guidance around phase two whenever that happens, and specifically for office work, if employees can telework, is it basically advised by employers to just work remotely as long as possible? That was kind of a two-part question for you.
Yeah. So yes, I would say most of this is related to phase one. Phase two guidelines have not come out yet. We should be seeing them fairly soon because, some counties have been in phase one. Because basically, after we were in phase one for 21 days, then phase two guidelines were going to start coming out once, basically once they could kind of look at what happened during phase one. So we haven't seen those yet. The second part of the question was, I would say, again, we go back to the hierarchy of controls, right? What is the best and most effective way to keep people safe? Have them work from home, if at all possible, particularly if you have office environments, or have them work from home 3 days a week and come into the office 2 days a week. Mm-hmm. Maybe you stagger when people are coming into the office. Those are definitely options. I would encourage people to be a little bit creative. How can we do things really differently so that we can keep people safe? But yeah, that's the safe.
I think rotation is a great idea. So finding a way to, if people need to be in, or there's people who want to come in, right? You've got your employees that are like beating down your door. We're tired of being at home. Our kids are here. We need to get out. So allowing some of those folks to come in on some type of rotation, I think is good. The one thing I'll add to that, and I'm not an expert on contact tracing, but if you're doing some type of rotation, you're going to want to keep track of who's around who, or have employees know who's around who, so that if somebody is exposed, you mentioned that, Brandon, what are we going to do if somebody gets COVID or thinks they were exposed? We need to have that as part of our policy too. And then the quarantining would need to occur.
Yep. Yeah, I would second that with contact tracing. It is really important that you would have people on a rotation on a schedule, so we would know who is here when.
Let's talk about taking temperatures. Several questions. I'm going to kind of merge it into one giant question, but regarding taking temperatures, can we as employers require employees to take a temperature at home and report the results? And also, as an employer, do we need to provide thermometers?
So as far as taking temperatures at home, I'm going to kick that one to Lacey, because that might be the same thing as asking an hourly employee to work from home. So I'll take that one. So I'll give that one to you, Lacey, and then I can answer the second one.
Yeah, you absolutely can ask employees to self-monitor at home. If there's if we are suffering or permitting them to work, that's where we start talking about whether it's compensable time or not. Taking your temperature, I think that takes maybe 30 seconds to do, depending on the kind of thermometer that you have. Best practice would be to pay those employees for that time. If you're actually asking them to fill out a sheet of paper that has them go through, these are the types of symptoms that might exist, have I been exposed? I would pay those employees for that time. I think you could start just by asking employees, do you have a thermometer at home? And if employees don't, or they don't have access to one, and it's a requirement for them to come into the office, if they can't telework, then I do think best practice would be to find a way to help them get that tool, because it's, I don't know if it meets the technical definition of PPE, but it's a tool that we're using to ensure that people are safe. I'll also mention, before I kick it back to you, Deb, that temperatures are not the only indicator of COVID-19. And so I have heard of lots of cases where people are asymptomatic, no fever, no other symptoms, and they're a carrier. So that shouldn't be the only thing that we're doing as the employer, to say we're checking the box, we're making sure that people are healthy before they're coming into the office. It's just one piece that may provide a little bit of mitigation in terms of exposing folks.
Mm-hmm. Mm-hmm. And then as far as taking temperatures at a work site, I would recommend a contactless thermometer. So those infrared guns, which are probably impossible to find now, but those infrared devices, you can position someone so that they can stay almost, basically, you get it about, an inch from someone's forehead. You want to talk to the person who's doing the temperatures, make sure that they have all the proper PPE as they're taking that temperature and recording it. That's what I would recommend doing. And I would do a temperature as well as some sort of questionnaire that talks about symptoms and also talks about potential exposure. Have you been around someone who's tested positive? Have you been to a hotspot? Those kinds of questions. Hopefully that answered the question.
Mm-hmm. Deb, we have audience members that are also in the state of Washington. Does Safety Northwest work with employers in Washington?
Yes, we do.
Okay, good. Yeah, I think we had like 3 or 4 people ask that.
Yep. We're very familiar with Washington's guidelines as well.
Good. Okay, we've got a few more minutes. Let's see, so many questions. Let's say somebody's on premise but not clocked in. Can we require employees to wear a face mask?
Yes. Yeah, a business can require anybody on their property to wear a face mask. We're seeing that. If you go to Costco, you have to wear a face mask now. So you can absolutely require that.
Okay.
I would sort of put that under general safety, right? It's just like I used to run kitchens, and even if someone was off the clock, they couldn't wear their headphones in the kitchen, even walking to the time clock. It's just about safety. If you're on premise,
Lacey, this one's probably for you. Do you have any suggestions for team celebrations or gathering? The employers will want to keep their culture intact, but this whole virtual thing is a little crazy. So what can we do?
It's hard. We're just even at Zenium, it's super important for us. Culture is really important. And so we've had just the way that we do things all these years, and we've had to adjust. We used to decorate people's desks for their birthdays and anniversaries with balloons and streamers and signs, and not happening. So, there are some creative things that folks can do. One of the things that I've seen work really well is Kudo Board. So it's a website. You can send a link out to folks on a team, and they can send little messages, and it creates this kind of bulletin board that can then be sent to that person to either say happy birthday or happy anniversary. I've seen folks, and I've done this here even with my team, doing parking lot gatherings. So sitting in the back of our SUVs in the parking lot, 6 feet physical distance, just having a coffee and seeing people in 3D face to face has been a really nice thing to do. So trying to find a rotation on maybe incorporating that, using virtual means, so Zoom or Microsoft Teams or GoToMeeting, whatever it is that's your company's preference, that makes a big difference. And, sending, e-gift cards and things, maybe you would normally bring flowers in for someone's birthday, or we'd have a company happy hour. Maybe there's a gift card that could be provided to employees so that they can go get coffee on you now that Starbucks is open and we can go in. So, I would, right? This is where it's like just going online and kind of seeing what's out there has been effective. And I think employees are understanding to a point, but morale has been affected in a really big way. And it's our job as managers, as folks in HR, as business leaders to get creative. Employees are counting on us to do that. And it's been a grind, right, the last 3 months. So whatever little ways you can do stuff is a big deal.
Can you repeat the website for the birthdays and the kudos?
I think it's Kudo Board or Kudos Board. And it's there's a free version of it. And then if you want to expand to get more people, I think you can do up to 10 kudos on one board at a time. So I've been using that with my team, and folks seem to like it a lot.
So if we have folks in the office that aren't complying with the safety rules and the policy around social distancing, how do we empower our people, for one, to call it out, but then two, at one point, as a manager or leader, do you step in and it becomes really a discipline issue?
Mm-hmm. I think it starts with conversations. Hopefully you have a culture where folks can talk to one another directly. So that's having just a safety culture. Not all businesses have that, and it doesn't happen overnight. But, we saw it even before, where people were maybe reckless on a forklift, and it's like calling out your buddy on the forklift, slow down. Like, you don't have to go that fast. You need to use your horn. I think this is the same. So it may take time for people to feel comfortable to say, hey, like, I'm not comfortable with that. But I think it's important that we try to empower people to do that, and that managers are paying attention to what they're seeing in the office too, if people are there. So if you're noticing that people are congregating together or they're just too close together, call it out, one-on-one with those employees. I think stop the congregation in the moment is probably a good idea right away. And then following up and trying to understand what was going on. And most of the time, I think people are I just forgot, or I just missed them, and I haven't seen them in a while. If it's a repeated thing, that's where I see this going to the point where we've talked about this 3 times, and at this point, it's a safety issue. So,
and I've heard people talk about you basically, each person stretches out their arms. That's roughly 6 feet. Also, people are probably tired of it, but things like, hey, respect my bubble, or don't forget about my bubble. I mean, there might be, kind of fun ways to sort of remind people,
Deb, so regarding restrooms, especially a place that's a shared, ones that might have multiple stalls, how do you maintain social distance within something like that? Something that you really can't shut down or just close down to employees.
Yep. So what I would do with restrooms is I would limit the number of people who are in the restroom. So it will depend upon the size of your restroom. Obviously, if you have a restroom that's the size of the airport, you can allow more people than if you have one that only has 2 or 3 stalls. So I think you kind of have to make the assessment there. But basically, if you've got 2 or 3 stalls, I probably would limit 1 person in the restroom at a time. If it's mostly just people within your organization, like an office group, then I think it's communication and signage. I've also seen, I've seen businesses have their employees sanitize the bathroom after they're done. That is not required, but if that's a good practice to do. So as people are leaving, they're wiping down the door handle, they're wiping down the sink, they're wiping down areas that they've touched. If you have a more public facing, like a restaurant or something like that, what OHA is recommending is they're recommending that you have an employee kind of monitor the bathroom to make sure that there's not congregation and there's not a lot of people in the bathroom, but they are not requiring it. But again, you do need to restrict use in the bathroom for sure.
I've seen companies put a lock on the door, so it didn't have a lock before. So that way it's not, you're walking in and somebody's in the stall and they're like, I'm in here, and there's this awkward exchange. So, or maybe there's a line with markers on the floor in the hallway near the bathroom or something, so that folks know this is where you wait. We're not going to wait inside the restroom too.
Okay, we are right at 11 o'clock. This has been fantastic. One of our audience members actually mentioned that Governor Kate Brown has a live press conference at 11 o'clock today to talk about maybe some of the phase 2 stuff. So maybe we'll learn more about some of the safety measures there. But Deb Bridges, thank you so much for coming on for this webinar, and Lacey Partipillo. This has been fantastic. As I mentioned, we will send, and it'll probably come from my email address, but we'll send the recording, the slides, and all the links that we mentioned. But thank you for participating. We had about 200 people on today, so it's obviously an important topic, and we were lucky to have you guys on. So thank you so much, and have an amazing day.
Thank you.
Thank you. Take care.